Hi, my name is Jubel Grace Bilalis, your student nurse for today. So in today's video, I will going to perform 3 different procedure. First is starting an intravenous infusion. Next is regulating intravenous flow rate. And lastly, discontinuing intravenous infusion. So the purpose of intravenous infusion is first to maintain or replace body stores of water, electrolytes, vitamins, proteins, fats, and calories in the clients who cannot maintain an adequate intake in mouth. Second is to restore acid-base balance. Next is to restore volume of blood components. Fourth is administer safe and effective infusions or medication by using the appropriate vascular access. Next is monitor central venous pressure. Next is provide nutrients while resting the gastrointestinal tract. And lastly, to establish a lifeline for rapidly needed medications. First is to check the doctor's order and make an IV label. This is to ensure that the client received the correct IV solution and medication as needed as ordered by the physician.
Next is wash hands. This prevents the spread of microorganisms.
So next is to gather all the equipment and prepare the IV solution and tubing because having all the equipment available saves time. So next is to check the IV solution and the expiration date. So this solution will expire on January 11, 2025. Next is check the IV tubing for the instruction and the expiration date as well. So the expiration date of this IV tubing is on February 10, 2025. So next is to maintain aseptic technique when opening the sterile package and IV solution. This prevents the contamination of IV solution and set which can infect rapidly the client.
Clamp tubing, uncap the spike and insert it into the entry site on the bag or bottle as manufacturer directs. If an additive is ordered, incorporate it before inserting the spike into the entry site. This punctures the seal in the IV bag or bottle.
Suspend the bag or bottle of the solution on the IV stand. The fluid height should be 18 to 24 inches above the level of the vein. This height is sufficient to overcome the venous pressure. Remove the cup at the end of the tubing, release the clamp, and allow the fluid to move through the tubing. This is termed as priming the tubing. Allow fluid to flow until air bubbles have disappeared. Close the clamp and recap at the end of the tubing, maintaining sterility of the setup. This is to remove air from the tubing which can in large amounts acts as an air embolus.
Notify the physician or nurse who will insert the IV. When he or she arrives, bring the preparation to the bedside. This facilitates accomplishment of the task.
Hello ma'am, good morning. My name is Jubel Grace Bilalis and I am your student nurse for today. And we're going to give you intravenous fluid on your hand to maintain your electrolytes. Have the client in a supine or low Fowler's position in bed. The supine position permits either arm to be used and allows for good body alignment. The low Fowler's position is usually the most comfortable for the client.
Suspend the bag or bottle of the solution on the IV stand. The fluid height should be 18 to 24 inches above the level of the vein. This height is sufficient to overcome the venous pressure.
Hand the tourniquet to the doctor followed by a cotton balls with alcohol and the needle or vasocan. Observe while the doctor or nurse is inserting. Anticipating the needs of the doctor is one of the good characteristics of a nurse.
Connect the tubing to the needle. Start the flow of the solution promptly by releasing the clamp on the tubing. Examine the site for signs of infiltration. Blood will clot readily if IV flows is not maintained. If the needle accidentally slips out of the vein, solution will accumulate and infiltrate into surrounding.
Support the needle with a small piece of gauze or tissue paper under the hub is necessary to keep the needle in place.
Loop the tubing near the site of the entry and anchor it with a plaster to prevent pulling of the needle. The smooth structure of the vein does not offer resistance to the movement of the needle. The weight of the tubing is sufficient to pull the needle out of the vein if it is not anchored.
Anchor the arm to the arm board for support if necessary. An arm board protects against the change in position of the vein and acts as a reminder to the client to minimize arm movements. Adjust the rate of the flow according to the doctor's order. The physician prescribes the rate of the flow. Complete the label and tape the IVS bag or bottle. And then do the aftercare of the client and wash your hands. This deters the spread of microorganisms.
Monitor periodically at least every 30 minutes to check for the flow rate and observe for infiltration and other untoward symptoms. This documents the client's response to
So next is regulating intravenous flow rate. The purpose of this is to comply with the prescribed rate ordered by the physician. Next is to maintain an equal and constant rate of fluid administration throughout the duration of the infusion. Next is to assist in reassessing the progress of the fluid infusion. And lastly, this is to prevent circulatory overload or insufficient correction of hypovolemia. So for the equipment, we need to have watch with second hand, calculator, paper and pencil, tape, and label. Need to review accuracy and completeness of physician's order in client's medical record for client's name and correct solution, type, volume, additives, rate, and duration of the IV therapy. And follow the 10 rights of drug administration. This is to ensure the correct IV fluid is administered.